the policy is formed in order to ensure protection, overall protection, and providing security for the old-aged people in the state. And with that, we have to ensure their participation in the social activities also. We have to bring them to the society. Nowadays, most of them lead a secluded and isolated life. So we have to bring them back to the society, and we have to utilize their expertise, experience, and knowledge for the sake of the society. Most of them have a wide variety of experiences. So we have to utilize them, and we have to ensure the intergenerational relations also. Intergenerational ties should be strengthened. All these elements are included in the policy.
In fact, what prompted the Kerala government to actually come out with such a policy? Because I think it is the first time any state in India is coming out with an exclusive policy like this. So what was the reason why Kerala government decided on this?
The number of senior citizens in Kerala society is increasing because of the specificity of the health sector of our state. Public health facilities are available to all. So, mortality rate and most of them are very healthy. All these things have to be considered. That is why we were determined to form an old age policy. The number of old people in the society is increasing day by day, and the younger generation, because of the societal system, they are very busy. They are very busily engaged in their own affairs. There is nobody to look after the affairs of the old-aged people. So it becomes the responsibility of the society to look after them. So we have to develop a assistive mechanism by the government.
Okay, madam, can you tell us what happened today because the cabinet approved it, the policy?
Yeah.
Can you just tell us that the Kerala has introduced this and the cabinet has approved it?
Yeah. Complete health coverage will be there. Insurance policies will be given to the old-aged people, and a palliative grid is being developed with the help of the palliative organizations and the organizations which work for the elderly in society. This is the biggest palliative grid in India. So those who are in bed will be getting domiciliary care through this palliative grid. I think this is a model for India, for the rest of the country.
And madam, how are you going to implement this? I mean, the whole proposals which have been brought out in the policy.
We have already started to implement it.
Okay, with the help of?
With the help of voluntary organizations, NGOs, and other organizations which are active in the area of geriatric care.
And also with the local self-governments.
Local self-governments actively participate in such projects.
Okay.
They put forward such projects.
Okay, but by the just ordinary look, I mean, it looks like a very ambitious plan. There's a lot of proposals there.
Yeah.
So what is the time period you are looking at in putting all this on?
We have already started most of the projects. Even now we have many projects related to strengthening of intergenerational ties. And providing health care for the old-aged people. We have a model project called Vayomitra. So elderly care is taken to the doorsteps. The service of the doctors, nurses, and other paramedical staff will be provided at the doorstep. Medicines are delivered at the doorstep. So it becomes easier for the older generation to live.
And you are in charge of the social welfare also. So can you tell us what is the situation of the elderly living alone? What is the number in Kerala? Do we have any statistics on our hand?
We don't have statistics as it is, but it's very evident. Most of them are living alone. Many youngsters go abroad in order to get opportunities related to education and employment. So and others are very busy with their activities, job related activities. Earlier women were there in families to look after the old people, but because of the pressing demands of today's system, they are being compelled to go out also. So there is nobody to look after the old people inside the house. So it becomes difficult for them.
So you said this network of social care centers also will be opened as part of
Yeah,
this
yeah,
policy
yeah.
to take care of the.
Retiring homes should be there for those who are capable of paying, and for others, free service will be provided by the government and the NGOs.
Okay, okay. So you have not put out a time frame as such. It is already being implemented now.
That will be for the next 5 years.